This is a 95-year-old woman with an extremely dense, brunescent, red-black nucleus. She had basically hand motion light perception vision. And you can see using the Zeiss Lumera scope, this is with a xenon light setting of about 4.0. There's a tremendous red reflex, which I don't think you would ever see with a standard halogen scope. For sure this would be a vision blue case, but I had no trouble visualizing the anterior capsule through the rexus. As you can see, I can't overemphasize enough how tremendous the view is here, given the density of the nucleus. This lady was unfortunately blind in her other eye from endophthalmitis from a retinal detachment repair that she had many years ago, and basically had waited 15 years because of fear of having surgery on the other eye. I was concerned about zonular laxity initially just because of how her age and the density of the nucleus, but it didn't really seem to be a problem throughout the case. After hydrodissection, I began by introducing some visco to try to protect the endothelium. I used Alcon's Infiniti with the ozil technology. During the sculpting, I had to use a combination of torsional and longitudinal because the torsional alone was not enough to make any kind of headway through this extremely dense brunescent nucleus. As you can see here, normally I use a stop and chop technique. Here my plan was to try to do more of a quadrantic divide and conquer, and then attempt to chop the remaining quadrants as much as I could. The volume of this nucleus was enormous. It was almost like two nuclei in one, and I thought that each quarter would be almost like a heminucleus when it came to chopping. So I began by coring down as deeply as I could, and obviously in a nucleus like this, you want to try to get at least 90 to 95% through to get a good chop through those thick, to get a good split rather through those thick, leathery posterior fibers. And you'll see that I had to rotate the nucleus several times to get to the proper depth that I needed. Here I'm on 100% torsional with about 40% longitudinal phaco, linear for both. As I focused down into the trough in this nucleus, the visibility was tremendous. The Lumera gives you the ability to perceive depth in the anterior chamber and see the individual lamellae of the nuclear layers like never before. Here I'm making the final pass, and you can see the dense brown leathery fibers of this nucleus. Here I'm attempting to make my first split, which was successful. If I hadn't been able to break through that right there, I would probably have widened the trough to try to get a deeper purchase. But because this is a 45-degree miniflare with a Kelman tip, it tends to make a narrower trough, and sometimes you need to widen the trough to get the proper depth. But in this situation, I was able to do it with a single pass. There was some difficulty in rotating his nucleus, even though it was very well hydrodissected. I think just because of the enormous bulk of the central nuclear core. And finally, we're able to get a pretty good split through the center and all four quadrants. And at this point, I'm going to put some viscoat in to protect the endothelium. And you'll see me do this a number of times throughout the procedure. And I'm going to go to a higher aspiration flow rate. And generally, in this situation, my settings are I use linear torsional and linear aspiration with a maximum aspiration of about 50. And here I'm doing some chopping. You can see this big, thick, dense nuclear core splitting nicely using a Fukasaku chopper hook. And usually my chops are horizontal rather than vertical. I don't like going behind the posterior capsule or around to the capsule to try to chop vertically. My minimum aspiration begins at 25% of the total. So as soon as I'm in foot position 3, I'm at 25% of 50 or whatever my flow I set at, and increase it linearly as I go along. And I find this gives me very good control. And you'll see there's great foulability with ozil. Pieces come in very nicely. I did have to use about 30% longitudinal phaco with burst because the torsional alone wasn't enough here to get this huge brown nucleus out of the eye. The vacuum I usually have fixed, and it varies anywhere from 350 to 450. And I always have the bottle height as high as it can go. And you get a very stable chamber. She had a fairly narrow chamber, both anatomically and also phagomorphically because of the size of the nucleus. Here, as I've gotten about 50% of the nucleus out, I'm going to add viscoelastic again. And actually, this patient on post-op day 1 had almost a completely clear cornea, just maybe trace folds. It's important when you reintroduce viscoat to just step on the pedal just to clear your phaco tip before re-engaging the nucleus so that you don't get a wound burn. And here I'm chopping again. Each of these quarters chop into a couple of different pieces. It seemed like a never-ending nucleus. You can see the very good chamber stability here despite very high flow rates. I'm taking caution here to not be too close to the endothelium, trying to stay midway in the chamber. And you'll see as I get towards the last pieces that I'll bring my chopper underneath the phaco tip to protect the posterior capsule from coming up. Towards the end, I switched back to pure torsional right about here because the longitudinal, the addition of the longitudinal phaco tends to push the pieces away from you, and I like. I normally use 100% torsional. Once I'm toward the end, I don't really need that longitudinal anymore to get these last few fragments. And you certainly, I think, have better control with pure torsional. And that's it. And you can see the brilliant red reflex almost immediately. And then after cortical removal, implantation of an Acrosoft SN60WF into the bag. And this patient on post-op day 1 was 20/30 uncorrected and had trace folds in the cornea and was quite happy with the result.